This is from an Instagram post from one of their patients. Tell me what you see. What does anything in particular stand out to you? In looking at his teeth, just his teeth, does something stand out or just not look right?
I don't know. Maybe the smile looks a little weird.
Why does it look weird?
It's just not showing the top part of his teeth.
Thank you. So the smile line, the curve of Spee, he's showing about, so we have something that's called golden proportions. So what that means is that the upper teeth, like when you smile, you have golden proportions, or when I smile, I have golden proportions. The upper teeth proportionate to the lower teeth are in that golden proportion era. So I'm showing like 3/4 of my upper teeth and about 2/3 or 1/3 of my lower teeth. I'm not showing more lower teeth than upper teeth. In this case, he's showing so much of his lower teeth that it looks like he's, kind of doing this. That's basically what you're seeing here.
It's an upside down smile.
It's an upside down smile. That's exactly what it is. And the video of him, he's just elated about his new smile. He's elated about, having his teeth done in 24 hours. And I came in and the next day it was done. But you're getting this kind of result? Mm-hmm. And you're like, that's the final, you're stuck with that. Again, you cannot be the morals that we have to have when we're doing these procedures. And I had a patient the other week, as I was doing his case, because one little thing was off here or there. And he's like, "Doctor, I'm so grateful that he's like, so many times I just wanted to be done, but you just kept making changes almost to the point where I was like, oh, come on, this is good enough, right? But I wanted it to be absolutely perfect because when it's done, right? And there's no way I would send a patient out the door looking like this. There's just simply absolutely no way. But that is my moral compass. That is my integrity. It represents me. It represents my practice. It represents my skill set. It represents my profession. It represents my training. And so if I send a patient out looking like this, I have failed. I have completely failed, and I do not know what I'm doing. And that to me is what this screams. It just screams. If the doctor didn't see this, it's like, oh, it looks fine, whatever. Next,
Yeah, you know what? It almost looks like the before picture of someone.
Right? This is the after.
And that is the after, but he probably doesn't know any better,
He doesn't know any better. He has teeth now because he probably had, something like this. So, of course, that's not his pre-op photo, but he probably had something along these lines. And, to have this, it's like, oh, gosh, I don't know. Looks pretty good to me. I mean, I'm not a dentist, but
you can eat now.
I can eat, and I have teeth. I have a reverse smile. It's upside down, but it's and I got it in 24 hours. So hey, I'm a happy camper. But it's a catastrophic failure, 100% catastrophic failure, and the doctor should be ashamed of himself for having delivered this and just said, "Okay, Mr. So-and-so, you're good to go. You look great. And then, Miss Jones, come on in. Let's finish you up." And that's just not me. That's not what I do. That's not what I would just never do that. I couldn't sleep at night.